Welcome to Dental Business RX. Practice success in 30 minutes or less.
Thank you for calling ABC Dental.
Early on in my career, I learned what would turn out to be a critical lesson when it came to helping our clients as well as working with team members. I'll give you this scenario. I was working with a newer client, dentist, new to the program. And to give you an idea of how the MGE Power program works, this was a long time ago, but it still sort of works this way. There's a lot of training involved in the program, hiring, organization, staff management, etc. And when a client starts, they have all kinds of problems, which, they may not get to the training for that problem for 3-4 months. So what we normally do with a client, because there's a coaching component to the program, is we'll help with those immediate issues, sort of like triage, and just deal with them on a coaching type basis until they learn how to do it themselves on the appropriate training, right? We give them specific targets to do this. So this was a newer power client, and I sat down with her, and we looked at what was going on with her practice, and we came up with a list of about 18 action items having to do with the schedule, sales, staffing, etc., that she was supposed to go work on the coming week to start putting order into her practice. So off she went with the idea that we touch base the following week to check on progress. Following week comes, we meet, and I started out with the list that we'd made the prior week, to see how far she'd gotten. Well, what had happened? She had gotten 0 of these targets done. Now, why? She's a productive doctor. She was also a mom. She was working tons of hours. She's, chairside with patient care. She had a very unstable office manager and a couple unstable staff members. So there was no deficiency with her. She went on later on in the program to have almost a 7x increase, doing 7 times what she came to us doing initially and become wildly successful. So what was the problem? It was 2 things. Number one, she was overwhelmed. She was working hard, had a lot going on. She was trying to do everything at once, and she was a bit of an overachiever, which describes a lot of people, including myself. So, and describes a lot of clients we get. She has to do everything, and it all has to happen right now. And she was overwhelmed. And number 2, what I learned is when you give somebody who's overwhelmed and has that much going on more things to do, tons of things to do, usually they end up doing nothing. So ultimately, what was the lesson? Well, I dialed things back at that point. I went and I took a look at what was actually going on with her situation, and I dialed it back, and we came up with the 3 most important things that she had to get done right now. We looked at all the things she wanted to get done, and I went, okay, well, these are the 3 most important to start moving in the right direction. If nothing else happened, these 3 had to get done. So we meet the following week, and what happened? Next week went great. She got all 3 things done, and her stats had responded. And this is something I've applied to clients and to team members for years, and it works out really well. In other words, you dial it down to the most important things, especially when you're dealing with somebody who's got a lot going on, and they can focus on those couple of critical issues, get those done. Then once those are done, they can then build on that, which is what happened with this client. Eventually, she had all kinds of great stuff happening in her business. And it's with this concept in mind that I'm rolling out this week's episode, and I want to talk about the subject of sales. I've done quite a few episodes on sales, and I've got into all the complexities about how to, and there's still a lot more I could go over, trust me, on how to, improve sales and case acceptance in your practice. But for this week's episode, I want to dial it down to the simplicity. What are some specific things that we could focus on? Maybe 3 vital things you could focus on right now to simplify your sales process and start moving on the road to improvement. My name is Jeff Blumberg, and I'm your host. And I figure the best place to start is why, with most newer clients, one of the areas I'm going to focus on is sales. Why would I focus on sales? Well, because sales directly relates to your income. And I know in healthcare, people don't like calling it sales because it conjures up the idea of car sales or cell phone sales or whatever. But if you think about it, sales is basically getting somebody to pay for something that they need or want. That's sales, closing, right? So that's essentially, we call it case acceptance. And why is this important? Well, if I could teach you some basic things, let's say you have a patient who comes in who needs 6 crowns and you don't have enough time to present the case, or you don't know what to say and you don't close those at all, You've just lost potentially, if you're charging $1,400 a crown, you just lost $8,400. Or let's say you don't know exactly what you're doing. You're presenting the 6 and the patient only opts to do the 2. Again, okay, so now you've done 2,800, or you have potentially 2,800 in production, and you lost another $5,000 in change. And the funny thing about it is, obviously that's going to affect your collections, but the funny thing about it is if that patient does the 6 crowns, it's actually a win-win, not just for you. It's not like you collected more money and you got to do 6 crowns now. It's also a win for the patient. They're now getting the actual treatment plan that they needed to actually sort out and improve their situation. So with that, let's take a look at some of the immediate things you could do with zero training, because we have a ton of training on the subject of sales. We have the MGE Communication Sales Seminar. I'll put a link to it on the episode webpage. It's 9 days of sales training. We also have other sales courses that you do as part of the MGE Power Program. I'm not going to put a link to that. I'll put a link to the Power Program if you want to find out more about it. But we do a lot of training on the subject of sales. But what are some immediate things I could give you? I'm going to give you 3 things that you could do right now. If you're listening to this in the car, you could start doing these things when you arrive at the office today to start improving case acceptance in your practice. So what's our first one? First thing that I would tell you to focus on is make sure that you have time to sell. We build time into the dental schedule for diagnosis, exams, and we build time in for treatment. We very rarely build time in for treatment presentation. It's sort of done off to the side, or the doctor does a little bit of it and then passes it over to a treatment coordinator. We've been doing this for a real long time, folks. And there are certain instances where you can eventually evolve to the point where the doctor has minimal involvement in the treatment presentation process, but that's for a very evolved practice. For the average solo practitioner, or maybe even one associate practice, usually where we start is, the doctor presents the treatment plan. Well, the doctor has to have enough time to effectively present that treatment plan. And, let me frame this for you. So if you're presenting, let's say a $6,000 case to a patient who makes $60,000 a year, and you're going to do this in 3.5 minutes because it's a recall patient and you have, 5 minutes to do the exam and explain what they need, even though maybe you've diagnosed this before. Most people aren't going to make a decision to spend 1/10 of their yearly income in 5 minutes. You need time. And if you're trying to improve sales in a practice, there's 3 things you'd focus on. 1, you want to make sure there's enough people to sell, meaning you have enough new patients and patients coming in through hygiene who need treatment. The second thing is you'd improve sales skill, which is what those seminars that I'd mentioned earlier in the episode are about. But then you'd also handle the organizational side of sales. And the organizational side of sales, part of that is actually organizing the time to actually sell. So how would you roll this out going into the office? Let's say your schedule is just jam-packed. You're going to walk in today and you have a few new patients. Maybe you see your new patients in hygiene and they're there for an hour. And you have some patients in recall and you have 5 minutes to, bust over there for 5 minutes and do a quick exam. So let's take a look at each of these. So with a new patient in 20 minutes, if it's a smaller case, you probably have time to go in there. It's, hygienist is seeing the patient, doing the full mouth and doing the perio probing or whatever. You probably have 20 minutes where you're going to go in there, do your exam, your charting, and get to meet the patient. And you're probably going to have about 5 to 6 minutes to actually explain your findings. So if it's a small case, obviously you can just sell it then and there on the spot. But if it's a larger case, let's say this is a $10,000 case. I've just come into your practice. You've spent 15 minutes getting to know me and doing my exam. Well, you only have 5 minutes and you just met me. You don't have enough time to properly present this case. Even with a $5,000 case, you might not have enough time to properly present this case. So here's what I would change if I were you. And obviously, look, if you're doing this now and you're hardly presenting the treatment and giving it to a treatment coordinator and you're closing 60 to 80% of the cases, don't change anything. It's working for you. But if you're not, which is, probably 90% of the people that I talk to, here's what I would change. If you don't have time to present the case effectively, like take a look at how much time would it take to properly present this case, answer all the patient's questions, explain, and I'll get into what you should be doing when you do this. But to properly explain it, answer their questions or whatever, it's probably going to take you at least 20 minutes, let's say, in certain instances, maybe longer if it's a larger case. If you don't have that 20 minutes, you're better off not presenting the case at all and bringing the patient back than halfway presenting it and leaving the room. Because these are the ones where you present them in 5 minutes. You didn't have time to do the whole thing. You walk out of the room, goes to your treatment coordinator or your front desk. You ask later what happened to that patient and they're thinking about it. Not worth it. Don't present a case you don't have time to close. So what I would do in these cases is I would bring these patients back on your schedule within 1 to 3 days, for what we call a consult appointment. This might be 20 minutes. If you're on a 10-minute book, it'd be 2 blocks, right? If it's 30 minutes, depending on, you have to sort of assess how long is it going to take for you to properly explain this to this patient, 20 minutes, 30 minutes, etc. Bring them back for a consult. And you might go, well, okay, how is this going to work? Well, you've done your exam, you've gotten to meet them. You've collected all your data. You've done whatever scans you're going to do and things of that nature. And then you tell the patient something along the lines of, it's great to meet you today. Here's what I'd like to do. I'd like to bring you back for a consultation appointment where we can discuss what I found today and the course of action I'd like to take to resolve the issues that we've discovered. Now, of course, or something along those lines. You don't want to start explaining the treatment plan to the patient without time to finish explaining it. You're giving them a little bit of a mystery, right? So, the patient will, of course, ask, well, what's going on, doctor? How much is this going to cost? And you might say, you know what, I want some time to study all your records, make sure I come up with the right course of treatment for you, the right path. And that's why I'm bringing you back for this appointment, for this consultation. You and I can sit down undisturbed. It's just me and you. I'm going to answer all your questions and explain everything. You might even ask him at that point, if you want, not to make this too complex. This is supposed to be simplifying the sales process. If anybody else is ever involved in healthcare decisions, a spouse, in which case they should bring the spouse with them. And then figure out when you want to bring them back. You might have time blocked on the schedule for consults, or you could ask your dental assistant, when do I have consult time available? And to be clear, consult time would be uninterrupted time. You can't do it while you're having to get up and go numb up a patient or do a recall exam. This has to be time where you are being left alone, maybe first thing in the morning or first thing after lunch or something like this. And you tell the patient, well, I've got an opening day after tomorrow at 9. Can you be here? Oh, yeah, sure, doc. I can. Okay, great. I'll see you day after tomorrow at 9. Now, are some of these patients not going to show up for this consult appointment? Yeah, that could happen. Are a lot going to show up? Absolutely. And then if the patient asks something like, well, am I okay? Do I have cancer? And you obviously don't see any indications of it. Don't freak the patient out. It's one thing we all hate about medical testing, right? We get a test and we'll let you know in 3 weeks what's going on while you're freaking out for the next 3 weeks. If you haven't seen any signs of pathology and you would feel comfortable saying it, tell the patient. You're the doctor, right? No, nothing like that. There's just some things going on that I want to discuss with you. Then you bring them back for the consultation, which we'll talk about here in a second. And I'll get into this because I want to talk about patients of record next. But that's what you do with new patients. If you don't have time to close it today, don't start the sale. Bring them back for a day where you actually have time. That day has to be within 1 to 3 days. It can't be next week. It can't be the week after next. It can't be 3 weeks from now. It has to be within 1 to 3 days. I prefer the next day or 2 days, but if it has to be 3, make it 3. The key here is you want to get them back in because now they're interested in actually getting their dentistry sorted out and done. Now, eventually, we have more advanced scheduling techniques where you can bake time into the schedule for this with a new patient. And there's ways when a patient calls in from an intake perspective where you can kind of determine whether this is going to be a more involved treatment plan or a less involved treatment plan. Obviously, you haven't looked at it in the doctor yet, but there are some questions your front desk can ask, like, are you missing any teeth and things like this to help you determine, or are you in pain? If this is a more involved case and you can actually book the new patient for longer, it already pre-block that presentation time for you. But we're keeping this simple. For now, if you don't have time to present and close, don't start it. Now, if you do have time, you're in there for that new patient exam and you've spent your 15 minutes and you've done your exam and whatever you're going to do, and you don't have another patient for 20, 30 minutes, I'd ask this patient, how much time do you have? Well, I'm off today. Okay, good. Let's sit down and go over what we found. And then you can present the treatment plan same day. Presenting same day is always going to be better than bringing them back. That's a no-brainer. But it's worse to half present it than to not present it at all and bring them back. Let me say that again because I confused myself as I said that. In other words, if you have 5 minutes, which isn't enough time to close the case, you're better off bringing them back. If you have time to present and close the case, 20 minutes, however long you feel you're going to need, by all means, present it now. And don't forget it's not just you that has to have time. They have to have time. If they're, running out the door in 6 minutes, don't try squeezing it into 6 minutes. You're just blowing the sale. You could go from a business perspective, that's bad, you're blowing the sale, but potentially this is, treatment that this person needs. You want to make sure that they're fully informed and understand why they need it. So you need the time to properly explain it. So that's the first thing, time to sell. How would you apply this with patients of record? Well, that's funny because when clients come to the MGE communication and sales seminars where we go over how to, increase treatment acceptance, most of where their increased income comes from initially is from patients of record. Because, if they're doing any marketing, it hasn't had any time to really kick in yet if they've just started with the sales seminars. So they start seeing an immediate improvement on closes with their patients of record. So these were people that they'd already diagnosed the last time that patient was in, 6 months ago, 3 months ago, or whatever, that the patient didn't accept. And they start to see an improvement in case acceptance there immediately because these are patients that they've already diagnosed treatment. So now a couple things with a patient of record. It's going to take you less time to present a treatment plan to a patient of record than it is with a new patient, mainly because there's a degree of familiarity with a patient of record, whereas a new patient you've just met for the first time, number one. Number two, with a patient of record, you still need time to present that treatment plan. So let's say it's some guy, Bill, and you diagnose they need 2 onlays and 2 crowns. Last time Bill was in for his recall appointment 4 months ago. So, and you told Bill what he needed, and Bill told you he would think about it, and then nothing ever happened. So Bill's back, and you bop over for the recall appointment or recall exam. You've got, 5 minutes to do this. Well, if you have time to present properly to Bill, that 20 minutes that you might need to close this case, then present to Bill. If you don't have time, bring Bill back for a consultation. Okay. You might go, well, why would I do that and whatever? And I just would, because you need that time in order to properly explain to Bill what Bill needs, answer Bill's questions, make sure Bill build value for Bill so they understand, not they, Bill, keep saying Bill, understands what's going on. And same thing. You know what, Bill, I'd like to actually bring you back, did your exam today. I want to actually bring you back for a consultation. There's some things I want to go over based on what I'm finding here. And I want to explain them to you, just me and you, nobody else, and answer any questions you have, because there's a few things that I'd like to make sure that we get taken care of right away. Well, what are they, doctor? You know what? I'm going to look at the new x-rays that I have. I'm going to examine everything. When you come back, we'll sit down and we'll go over it. Usually a patient of record will keep that consult pretty easy. You bring them back again, same rules, within 1 to 3 days, 20 to 30 minutes uninterrupted time. Okay. Now, obviously, again, if you can present to Bill same day, present to Bill same day, but start giving yourself time to close these cases. Okay. That's the first thing you could change right this second. Okay. That you would see an immediate increase in case acceptance. What's number two? Number two is the actual presentation process. So now a couple things, you may or may not be doing some of these things when you do your presentations. And obviously I'm not going to infringe on the clinical side of your presentation. You're the doctor. You're the one treating the patient. I have no interest in interposing myself there. I'm just talking about how the treatment plan's explained to maximize understanding. So let's say Bill, that patient of record, is back for their consultation, or you're presenting same day because you have time, or that new patient same day, or you've brought them back for this consultation. So what are you going to do during this treatment plan presentation? Well, a couple basic concepts here. Number one, whatever we're explaining, we're being very careful, because remember, the majority of people you're talking to on a day-to-day basis are your fellow team members, your staff, your hygienist, your assistants, possibly your associate doctors. So you're using dental lingo all the time. You're talking about taking a PA on that tooth. You're talking about whatever abbreviations you might use for things, an FMX or, this or that or whatever. Patients don't speak dental language or dental abbreviations. They don't know what an abscess is. Some people will, some people won't. They don't know what a radiolucency is, all right? They don't know, what the buccal surface of a tooth is. I'm sure some people do, but it's just not something that people talk about, in life. It's just not a thing. So first thing is, whatever you're explain it in such a way that the person understands it and realize you're not talking to a dentist or a dental industry employee. So you're talking to somebody who knows nothing about dentistry. They know about teeth because they have them, but that's about it. You're talking about infections. You're talking about this dark spot on the x-ray. You're talking about different things and explaining what that means. Okay. You're keeping it really, really simple. All right. That's the first thing. Don't use dental lingo. Okay. It's the outside of the tooth next to your cheek. Okay. You're not using surface names. All right. You're not using tooth numbers. It's on tooth number 8, unless you want to explain tooth numbers to a patient. It's, this tooth in the front. Keep it real simple. Number one. Number two, you want to have, when you explain the treatment plan, you keep it real simple. This is what you found. Make sure they understood what you found. This is what you want to do to sort it out. And this is why it's important and what the consequences of not sorting it out are. Okay. So I found this. Okay. And this is what I want to do to fix it. And ensure they understand what that is. They know what an implant is now. They know what a crown is. You might even grab some, might have an implant in your room or a model of an implant. It's going to make a joke. Like, make sure it's not some big model of an implant. So they don't think this thing that's 4 inches long is going in their mouth. Have some old lab cases so you can show them have an implant. Have these things so it creates more reality for the patient. They see it like, oh, that's an implant. That's what's going to go in my mouth. Or, here's what a crown is. Maybe they've never had a crown before. You probably have an old case in the lab where the patient never showed up to deliver the crown. Show them a crown, right? So they can get some reality on what it is you're trying to do. If they don't understand what you're trying to fix or what the problem is, this is where you use your intraoral camera, right? Where you can show them pictures or, with the mirror, or run your tongue over there. You see how that cusp is missing on your tooth. Make sure they understand the problem. Make sure they understand what you want to do to solve it. And make sure they understand what happens if we don't solve this problem. So what's the problem? How do we want to solve it? What happens if we do nothing? So if we leave this alone, this is potentially what could happen. All right. So especially if somebody's thinking, well, it's really expensive for this crown and build up. Well, if the direction it's going, especially if you can show them like it's been getting worse the last few checkups, right? And the direction this is going to where eventually they may need a root canal. Well, now they've doubled the cost for restoring that tooth, or eventually the tooth goes bad and now they need an implant. It's going to cost more for them to wait than to just do something now. All right. So what you found, what the plan is to fix it, and what happens if we don't fix it, right? And then the last point is mention the fee. You should at least, and I've done whole episodes on how to discuss fees. We've done a bunch of them. I have Sabri on for a few of them as well. But at least tell the patient, look, for these 4 crowns or for these 2 onlays and 2 crowns, it's going to cost X amount of dollars. Or whatever your fees are, $6,000 or $5,800. You might even have a little treatment plan sheet there with you. At minimum. Now, you could present this plan with your treatment coordinator or your financial coordinator present. And you might want to just make this a matter of course with these bigger treatment plans with a new patient or a patient of record. You just have the treatment coordinator or financial coordinator, whoever does this in your practice. If you don't have one, it's probably your office manager, in the room with you while you go over it. And at minimum, mention the fee. It's $5,800. And the patient might go, wow, that's really expensive, blah, blah, blah. I understand. And, I'll have you sit down with Mary and you guys can take a look at different ways that you might be able to do it. All right. That's the bare minimum. I'd rather you took the conversation a little further. Again, I've talked about that in other episodes. You might ask them, well, how would you pay for something like this? If you're not ready to do that yet, and again, we're trying to keep this, remember, it's simplifying the sales process. At least tell them the fee, and you've gone over what's wrong, how you want to fix it, what happens if we don't fix it, and this is how much it costs. If there's a projection of how much insurance is going to cover, you can tell them that as well. Then have your treatment coordinator work with them to get them paid up for it. So if we look where we're at so far in the presentation process, we've got our time baked in, right? We're using simple language. We've explained what the problem is, what we want to do, and what the consequences of not fixing it are, and what the cost is. The only thing I would say, 2 last little bits here. One is if the patient's sort of balking on the fee, wow, that's a lot. I think I'm going to have to wait, blah, 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 blah. You might ask a question like, well, do you want to do this treatment? The reason I bring that up is I've seen people get into arguments about money when selling something for like a half hour. And then when you finally ask the person who's being sold, like, do you even want this? They go, well, I don't know. Well, why would you argue about how much something costs for something the person doesn't even really want? I mean, that just seems silly, doesn't it? So that's the first thing. If they say no, well, then you need to explain the treatment some more. They don't understand what's wrong. They don't understand why you want to fix it, what the consequences of not fixing it are, etc. Last thing I would do is remember to stay a bit persistent, okay? Your job as a doctor is to restore patients' health. That's why you're there. You're elected with that responsibility when the patient comes to see you. So be a little bit persistent. Don't get balked by the first, well, I need to think about it or whatever. If you've explained a treatment plan to a patient, you ask them if they want it, and they, I think so, blah, blah, blah. explain it again, not robotically so that you sound like you're saying exactly the same things. You don't go, well, here's treatment plan, blah, blah, blah. You explain everything. And they go, well, I want to think about it. And then you just explain the same thing again. That would be a bit ridiculous. You might bring up one particular point. Let me show you this thing again about why I want to do this with this tooth, or let me show you this thing with this tooth that's kind of interesting. Bring them right back into the treatment plan. In other words, stay a little bit persistent. Okay. And obviously you see with the things I'm explaining, you need time to do this. You need time in order to do this properly. And again, here's the silly part of it. If you allocated, 60 to 80 minutes a week, an hour or two a week to making sure you actually had time to sell, your income might even double. All right. Because that time alone will get you sales that you wouldn't get if you tried to do them in 5 minutes, because you actually had time to properly present it. So it's worth investing the time and explaining the fee. Explaining the fee makes a big difference, believe it or not. Hearing it out of the doctor's mouth. If you don't believe me, go survey your staff and ask who a patient is most likely to listen to, and they'll tell you it's the doctor. So the doctor mentioning the fee for whatever reason is very powerful. All right. So those are the first two things. One, bake in time. Two, during the presentation, those issues that I brought up specifically. What's the last thing? Is you need to start planning your day a little bit. This is all, we're directing this all towards improving case acceptance, right? So when we say we want to increase case acceptance and I want you to plan your day, what do I mean by that? We have a handout. I've given it out before. I'll put a link to it on the episode webpage called The Morning Production Meeting. Now, a lot of people have a morning huddle or a morning get together or whatever you might want to call it. The morning production meeting is different from a clinical meeting. It's not like where you sit with your assistants and figure out what cement you're using for the patient at 11 o'clock. You're not that. All right. The morning production meeting is where you're actually looking at every patient coming into the practice today and isolating the ones that have outstanding treatment, especially on the hygiene schedule, and determining who's going to talk to them. So and who's going to be available to actually close the case and how it's going to get done. So for instance, let's say you're a solo practitioner, you got one hygienist, you have an office manager and another person at the front and a couple dental assistants. So you have your morning production meeting, you look at everybody coming in hygiene, not just the new patients, because truthfully with a new patient, you have no idea what's going on with them. You could hear broken tooth and that could mean anything, right? Or toothache could mean anything. You can't count on that, in other words. But you can see that the 10 o'clock patient that's in hygiene, you diagnosed, 4 crowns last time they were in. Well, you should go talk to that patient. Maybe they're not due for an exam yet, but we want to bake time in the schedule for you to go talk to them. And then, okay, the office manager is going to be available at that time to be in the op with you to make sure that they have time to engage in the financial discussion. Do you see? And you'll have a little bit of time so you can actually present the whole case. This is why you have the morning production meeting. I'm not going to get into all the specifics on it. I think I even did an episode on the morning production meeting, but I put that download on there. It's pretty self-explanatory. You can download it and read over it, but I'd implement that. And again, you might think, well, I've never done this before. How does this work? Just try it. I've witnessed a lot of morning production meetings, and some, to be honest, are terrible, but they're better than no morning production meeting. So you want to at least start implementing that into your practice. All of our successful clients use it. It actually helps you stay on top of making sure that patients are moving through their treatment plans because someone's actively talking to them and encouraging them to keep moving. So those are the 3 basic things. If I were to sit with you and you were overwhelmed, you had a lot going on and you want to improve your case acceptance, those are the 3 things, barring training, that I would have you address right now. Time, your sales process, and start planning it out at the beginning of the day so you know how you're going to direct your time to actually present your treatment. Now, to see if anything like this would actually benefit you, here's what I invite you to do. Look at the treatment. You take a minute, go into your computer software and look at the treatment that you've diagnosed and presented in the last 1 to 2 months. And look at how much of it is actually going to end up on your schedule. And if you find that you've diagnosed, $300,000, $400,000, $500,000 worth of treatment, and maybe 100 of it's on your schedule, you start to see where the problem is and where you have this lost income and, even more importantly, lost potential for patient health. And this is something you can do immediately to start improving your situation. Anyway, and obviously in the long term, you should get trained on these things. With the sales and communication training that I discussed, that's where you start to really master this subject and become better at it. So that's all I have for you this week. I have the downloads as well as links to the MGE communication and sales seminars and the power program on the episode webpage. I do hope this helps. And if you want more information about MGE, you can find us at mgeonline.com or call us at 800-640-1140. Folks, have a great week, and we'll see you at the next episode.